March 13th is World Delirium Day. We welcome Julie Rubel from Niagara Health to shed some light on this often misunderstood affliction. And Julie, first off, delirium is often mistaken for dementia. Is it the rapid onset of delirium that makes it different?
Absolutely, yeah. So the main difference absolutely is how quick the onset, as well as the fact that delirium is reversible. So dementia, as we know, is a progressive disease that will get worse over time, but we can identify why someone became delirious, and we can reverse those causes, we hope.
Is there a tendency for people to sort of panic when they first see delirium in a loved one?
Absolutely, absolutely. We often hear people say something like, "This is not my mom." It comes on so quickly, and people just know intuitively that something is wrong, and they panic because they're not sure why it's happening so quickly.
And it's not a sign of Alzheimer's, it's not a sign of dementia?
Not necessarily. So we do know that sometimes people who experience delirium do go on to develop dementia, but one is not necessarily directly related to the other.
What can people do to avoid having this kind of experience?
Yeah, absolutely. So we do know that that people can do a whole number of things. So one, stimulate the mind. So keep your mind active. Word games, being active in conversation. Moving is really, really important. This is to prevent delirium in the community, but also to prevent it to manage it when they're in hospital.
Getting exercise. It could be as simple as taking a walk a couple of times a day.
Totally. Getting out of bed and sitting in a chair, being able to stand and brush your teeth at the sink. Getting good sleep is also really important, which can be difficult to do in the hospital. So if it means bringing an eye mask and some earplugs, go for it. Making sure hearing aids and glasses are being worn as well, right? So if I can't see or hear the environment, it's easy for my brain to get a bit mixed up.
That's a really difficult one, right?
Yeah.
And I've noticed over the last 10 years or so, a lot of hearing clinics opening up
100%.
around the Niagara region.
Yeah.
It's so important to take care of those two little things, because if you're not understanding what's going on around you,
absolutely,
you're likelier to experience these.
Absolutely. And what they're finding out now actually is that hearing loss may be related to dementia. So anything that you can do to help protect your hearing or to help enhance your hearing, please do, for sure. The other couple of things would be to stay hydrated. And we know as we start getting towards the warmer months, or it's warm outside today, we want people to make sure they're eating and drinking properly. If that means in hospital that you need to remind people what mom likes or dislikes, go for it. We want to know.
What are some of the programs that Niagara Health offers for people who've experienced delirium?
Yeah, absolutely. So we have so across the organization, I should say, we really are trying to take a more proactive stance at identifying people at risk. And so those would be people who are over 80, people who have hearing or vision impairments like we've just talked about, people who come in who are really, really ill, and people who come in with hip fractures, and those people who have known history of cognitive impairment, so they have some memory changes.
Why the hip fractures, I should say?
It's the severe, well, so hip fractures are quite complicated, as you can imagine, but there would be pain. There's often the trauma of a fall, for instance, the surgical procedures, the things that we do in the context of hip fractures.
Traumatic events could bring this on?
Yeah, absolutely, and severity of illness as well, right? So yeah, absolutely.
Do we worry more about elderly people who are living on their own?
So only in that, so being on your own in itself doesn't contribute to delirium, only that it might be more difficult to recognize. So if you know somebody in your life, particularly as it gets to warmer months and people could be at risk for dehydration or they're at risk for falls, go and check. And then if you get the sense that you feel something's wrong, mention it, because delirium, as we say, comes on within hours to days. So it's something that comes on quickly and we need to get on top of.
Does Niagara Health help the families of the people who are suffering from delirium as well?
Absolutely. So it's important that we provide education because, again, we know that those people are going to be the ones that help us identify very often, and they need to know the things to do. So the things that we were just talking about are things that they can do, helping them move, eat, drink, make sure their hearing aids and glasses are in place. All of those things families can do. So we do provide education to families and patients themselves.
Julie, you're a geriatric specialist.
That's correct.
So these are things that I guess that you would have studied while you were earning that specialist.
Absolutely.
How prevalent are they?
How prevalent is delirium?
Yeah.
So because it often goes under-recognized, it varies quite widely. So we hear sometimes 1 in 3, sometimes we hear as much as three-quarters of folks, and that would be more in severe illness or things like trauma, like hip fractures. So it really varies so widely.
Can you give us some tips for healthy aging?
Absolutely. So a couple of things. We've talked already about the importance of movement. So do get up, be active, whatever that means for your capabilities. Keeping your mind active is also really important. So, trying to learn new things if we can. If you always wanted to knit, learn a new language.
I've heard a lot about learning a new language, but learning a musical instrument.
Absolutely.
As well, right?
Yeah, things that keep your brain active. Absolutely. And the new things that we're talking about also is social isolation and loneliness. So be active socially as well. So go to Tim Hortons for coffee, join a local public library, talk to your neighbors in the grocery store, that sort of thing as well.
Get out and join the mall walking group.
Totally, absolutely. Two things in one right there, absolutely.
On March 13th,
Yeah.
World Delirium Day,
Yeah.
what does Niagara Health do to recognize that?
Absolutely. So we do things like this, which is fantastic. We also engage in social media, and then we educate our staff directly. So we like to just test their knowledge of delirium and provide them some additional insights so we can recognize this important condition.
Thanks for coming in today, Julie.
My pleasure. Thank you very much.